Please stop listening to influencers who talk about cancer who have never done research, never treated a cancer patient, and frankly just don't know what they're talking about. It's so frustrating. What's up, beautiful people? I'm going to talk about a report released by the American Cancer Society recently. This is an area of passion of mine because I was a chemotherapy pharmacist. I worked at MD Anderson, and I was really close to becoming an oncologist until I hit a wall in residency. And I want to talk about this for two reasons. Number one, I really hate when people paint big pharma with just a big brush, saying it's all evil, that it doesn't want to cure patients, a cured patient doesn't make money. And yes, big pharma has done some terrible things. I call them out. They've approved drugs through the FDA that didn't really have any effect. There's been questionable marketing practices, all of that. Yes, I understand that. However, you can't say that they don't invest in cures. There are recent examples of this. Look at Gleevec. It treats a condition called CML. It's a type of blood cancer. Before this drug, 5-year survival rates were 30%. After the drug, and now with other drugs in the class, tyrosine kinase inhibitors, the 5-year survival rate's over 90%, and many people have a normal life expectancy. That's a humongous difference. And then you can look at hepatitis C with drugs like Harvoni. Hepatitis C, back when I was in pharmacy school, the treatments were awful using interferon. Side effects were terrible. Cure rates were low. And then you had these drugs come onto the scene, which could effectively cure hepatitis C in weeks. And that's really big news because hepatitis C can lead to chronic liver disease and liver cancer. And so these are just two examples where big pharma has led to cures of devastating diseases. So you can't just paint it with a big brush. The other thing that I want to talk about specifically is that cancer is an area where precision and personalized medicine has grown the most. In fact, it's standard of care now for many types of cancer to get a genome analysis for both prognostication and also for selecting the best treatment for that patient. Okay, so let's dive in. Let's get off my soapbox. These reports were released by the American Cancer Society and encapsulates data from up to 2022 and 2023. They estimate that over 2 million new cancer diagnoses will occur in 2026, with an estimated 626,000 people will pass from cancer. The lifetime probability of being diagnosed with cancer is nearly 40% in men and women, and 60% of cancer diagnoses over the age of 65 is when they occur. But an increasing portion of cancer diagnoses are occurring in younger populations, 28% in 50 to 64, 12% in those younger than 50. So still the lion's share is among older individuals. In both sexes, lung and colorectal cancer are two of the three leading cancer diagnoses. And then you have prostate in men and breast in women. Overall, smoking accounts for over 80% of lung cancers in men and women. In 2023, half of all people diagnosed with cancer were either former or current smokers. In 2023, about 11% of the U.S. population still smoked regularly, and that can vary by state. It has decreased, but we still have a long way to go. And it's estimated that 180,000 people will die from cancer attributable to first or secondhand smoke in 2026. And the report does talk about other lifestyle factors like obesity, alcohol intake, decreased fertility, and the risk of developing breast cancer. It also talks about how liver cancer is largely preventable. 75% of cases are attributable to modifiable risk factors. Now, overall, cancer mortality rates have declined, with an estimated nearly 5 million deaths averted since 1991. And this is driven by reductions in smoking, earlier detection, and improved treatment modalities. So the overall 5-year relative survival rates were 70% for diagnoses made between 2015 and 2021. The 5-year survival for regional stage disease was 69%, metastatic disease 35%, which was up from 54 and 17% in the mid-90s. And the largest gains were seen in 5-year survival rates in high mortality cancers such as myeloma, liver cancer, metastatic melanoma, metastatic rectal cancer, regional lung cancer. However, lung cancer is still the leading cause of cancer death, causing more deaths than colorectal cancer, which is second, and pancreatic cancer, which is third combined. So I just want to make people aware of these statistics. I think it's important. I think we're making great strides in how we diagnose, how we treat cancer patients. And this is an area that I will continue to read a lot about. It's very personal to me. And I'm really excited about the future and some of the new therapies on the horizon and also new diagnostic tools on the horizon.